Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Anurag Gupta, a DM cardiologist, and today we'll be delving into the silent epidemic that is India combating heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's become common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. So let's break down the five essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction or EF measures how well your heart pumps the blood. It is the amount of blood pumped out of your heart's lower chambers, that is the ventricles, each time it contracts. While a normal heart EF is around 50 to 70%, individuals with heart failure typically have an EF of 30% or lower. Secondly, why are so many Indians affected by heart failure? Well, genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits have worsened this epidemic. Moving on, what are the signs and symptoms of heart failure? Well, you've got to watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, and weakness. There's also loss of appetite or vomiting. How can we protect ourselves from this disease? Well, our hearts work incredibly hard to keep us alive. These are the five golden rules we can follow to return the favor. Number one, early detection of heart failure through regular blood tests. Number two, dietary adjustments to maintain heart health. Number three, incorporating daily exercise into your routine. Number four, practicing stress management techniques. And number five, the most important, quitting alcohol, tobacco, and smoking. So, lastly, what comes next after the diagnosis of heart failure? Well, thankfully, medical science offers numerous treatment options, and it is possible to lead an enjoyable, meaningful, and productive life even with heart failure. Heart failure medications have improved the quality of life, the longevity, and devices such as biventricular pacemaker, implantable cardioverter defibrillator, which is an AICD, and heart valve repair or replacement can also help. The last treatment resort option is heart transplant. So it is essential to remember the risk of CHF is 1 in 5 for both men and women. Remembering and being aware and taking proactive measures are key in combating the silent epidemic. Thank you.